A local woman who suffers from stage 4 cirrhosis is in big trouble with the law. Her name is Donna Lambert, and she's charged with 7 felony counts in connection with using medical marijuana.
And selling it. She sold a small amount of marijuana to an undercover cop because he did have a valid recommendation from a licensed physician, as we understand. We're going to talk to the DA about this. Now, Lambert claims she doesn't want others to have the same medical problems or to be ripped off by shady dealers on the street. That's what she says. Yesterday, she and her lawyer took that fight to City Hall, hoping to encourage members over there to change the law.
It started with hepatitis C. It was found that I had cirrhosis. I had to go on the interferon ribavirin chemotherapy treatment for a year, and it was then that I was really sick and they recommended marijuana to me. I don't know what triggered this Sjogren's disease, which is an autoimmune disorder of the connective tissue, whether it was the chemotherapy or the cirrhosis or the hepatitis C, but I'm struggling with that now, and I deal with a lot of pain.
What we hope to have happen is to set a standard in San Diego that says when you have somebody like Donna, who is a qualified patient, providing marijuana to another qualified patient, if that qualified patient doesn't do it for profit, then it's legal.
So apparently she was trying to do a favor, and it landed her in some big legal trouble. That's an inside look at what happened to Lambert, but there are always two sides to the story, the issue anyway. And this morning, District Attorney Bonnie Dumanis joins us to talk about this. You're saying it's a zoning issue, really, is what you're talking about.
Well, what the City Council, I watched it last night on TV, what they were looking at was forming a task force to look at the issues around medical marijuana, and also whether or not to have a moratorium or restrictions, zoning or permit restrictions on dispensaries or those places that have the medical marijuana allegedly there.
They have been popping back up.
Yeah. What impact has that had? I mean, these dispensaries that are going on. Have you noticed a big impact within our city?
Well, interestingly enough, those testifying yesterday at the City Council meeting were business owners that said they were cropping up near them. It was having an impact, a negative impact on their business, as well as there was a 17-year-old kid in a youth leadership group and a 14-year-old in a youth leadership group that was saying, please don't let these into our neighborhoods because we're fighting hard to keep kids from using marijuana, and if you let them in, it's going to be a difficult sell. So, you know, I think there's a lot of confusion around about the laws that now exist. We follow the law. We don't go after people that are using medical marijuana or marijuana that's intended to help them with cancer, HIV, glaucoma, you know, the serious illnesses that were intended. What we go after are those that are selling, that are profiting from the very people this was designed to help.
Yeah. So are you saying in the case of Miss Lambert here, are you saying that she was selling this for profit and that's the issue?
I'm not saying anything about Miss Lambert because that's
I thought you were going to talk about because it's a pending case.
It's a pending case. I can only talk to you generally about the issues around
Well, let me ask you this.
The law.
The person that she sold it to, did he in fact have a physician's letter? Or?
I can't talk about the specifics about this case.
That's how we understand.
So if someone, though, is possessing or growing marijuana for the purposes of medical use and has a recommendation from the doctor, then we don't prosecute those people. What we do prosecute, there is no provision for people to sell marijuana, period.
Let me ask you this, and I was really pretty surprised to find some people that I know have that card. How easy is it to get a medical marijuana card? Is it just, I mean, it sounds like what is happening in California is that you're diluting the law. This legislation is diluting the law. It's just making it not so hard to get.
Right. It really was meant to legalize in a sense, to make so many loopholes that it would make it easy. You can go into a doctor and say, I have a headache, insomnia, any kind of...
Bam,
and
get the card.
They will get, it's not a card, it's a recommendation. You can get cards now through the county. They just began July 6th. Since July 6th, though, only 105 people have actually submitted an application for it. But doctors are writing them for 6 months and then a year, giving them a discount. But what the problem is, they don't examine you. They don't ask for a history of what your medical conditions are or what other drugs you're taking so that the interactions can be weighed. And actually, since we prosecuted some of the cases where they were selling marijuana, the doctors, there were 3 doctors that actually prescribed or recommended all of them, and one of them was suspended, and one of them lost their license as a result of that because they weren't properly giving the care of medicine that's required of somebody practicing.
It's interesting. A year ago, people thought it insane that this congressman in Northern California even proposed legalizing marijuana statewide to help out with the budget, and now a majority of Californians in a recent poll show that they're in favor of it.
Well, I think it's a bad idea. And my experience as a judge, as you know, I spent 5 years in the juvenile court and then 2 years doing drug court. And so that's about 5,000 kids. Not one of them started with marijuana, ended with marijuana. They all went on to something else. And so it is a gateway drug. It does have ramifications, and people commit crimes in order to get it. So that's a debate that will go on, but I will fight fiercely against that.
All right. District Attorney Bonnie Dumanis, thanks for coming in.
Thanks for coming in.